My name is Helen. I'm an orthodontist and I work at the Bachmayer Orthodontic Clinic. We're located in Baulkham Hills in the Sydney metropolitan area. I think since I was a young girl, I've always had an interest in dentistry, while blood and injuries everywhere else on the body made me really squeamish. Anything to do with the mouth was something that almost always excited me. I know that sounds a bit weird, but I'd like to take out my baby teeth by myself, and I always had positive experiences at my general dentist, so I felt like it was a natural fit for me. And then once I did start my undergraduate dental degree, I found that I really enjoyed what I studied. I did my undergraduate dental degree at the University of Queensland. I graduated my dental degree back in 2017. It was a 5-year course and I really enjoyed every step of it. There was great learning involved in hands-on skills as well as learning interpersonal skills, dealing with patients. And then after I graduated, I worked as a general dentist for about 2 years, during which I really learned which specialties in dentistry that I particularly enjoyed. I was actually initially torn between going down the path of specialising in paediatric dentistry versus orthodontics, both of them have in common that you treat children, and I love working with children, but ultimately I wanted to do more than extractions and fillings, so I went down the path of specialising in orthodontics, and I have no regrets. I love orthodontics because you're able to focus on the bigger picture and see it's like solving a complex jigsaw puzzle. You see how all the pieces fit together. And I did my orthodontics degree in Canada at the University of Manitoba. That was a really interesting experience for me. Canada essentially feels like a colder Australia. People are really nice, but there are obviously difficulties in studying overseas because you have to understand how to apply and enroll and what the process is in order to become accredited in Australia when you return from an overseas university degree. It was a pretty long journey coming back from Canada. In hindsight, there was more involved and more hurdles than I expected, especially because in order to be accredited in Australia, you have to go through AHPRA, and AHPRA has very strict rules on which degrees they recognise. Luckily, with all Canadian most Canadian orthodontic degrees, there's an equivalence pathway that you can go through. You have to submit all of your orthodontic cases as well as the curriculum of the subjects that you studied. So I think I submitted maybe like a whole stack of paperwork, and it took almost 6 months to be accredited in Australia. So it was quite a long process, which I didn't foresee when I first applied to a Canadian degree. But if there's any advice that I would give to future orthodontists who want to study overseas is to definitely check AHPRA guidelines in terms of how to become accredited in Australia. And then after that first step of becoming accredited in Australia, the second hurdle that I did experience was that when you study overseas, you don't have the opportunity to network with orthodontists overseas. And when you're looking to apply for jobs as a new graduate, it's best that you do know more connections within that area that you want to be working in. So as a Canadian student, especially with the huge time difference, it was harder for me to connect with Australian orthodontists. But luckily, I grew up around the Baulkham Hills area. I emailed Dr. Bachmayer because he was the orthodontist that I used to refer to when I worked as a general dentist in the area. And he also did his orthodontics degree a long time ago at a Canadian university, and he understood the struggles. And we connected, and from there it's history. And then once I joined this orthodontic clinic, there was a steep learning curve. There were a lot of patients that you see in private practice versus in a university residency. So in university, you would see maximum maybe 20 patients per day, whereas in a private orthodontic practice you can see up to 100 to 120 patients per day. So there was a lot to learn, but I had a great mentor, and that helped me hugely in this process. And once I was comfortable with all the procedures, as well as interacting with so many patients per day, I gained the confidence to actually become a part business owner, and that's been a really rewarding journey for me. Last year I volunteered in East Timor to help patients who don't have access to private orthodontic care, and that was extremely rewarding. It really reinforced for me that orthodontics isn't just about like a cosmetic upgrade. It has a real profound impact on the way you chew and function, and a lot of the people that we treated, we were doing simple treatment, but that would significantly impact the way they could actually chew food and function properly. And so it was rewarding to be able to give back to the community in a way that helps make the world a better place. As corny as that sounds, it's been 10 years to get to the position of being an orthodontist from start to finish, from the moment that I went into dentistry, and I've had a lot of help along the way, a lot of great people who've helped me become an orthodontist, and that was a way that I could give back to them, and so I found that really rewarding. As well as more recently, we've opened a second location for our clinic in Tallawong, which is at the end of the Sydney Metro line, and that's been really rewarding and fascinating in terms of learning how to start a business from scratch, including the fit-out design, as well as finding all the right chairs and instruments and stocking properly, making sure that you're not too low on instruments, but you're not oversupplied either, and also training additional staff from scratch. That was also a learning curve, but extremely rewarding now that we're seeing more and more patients come through our doors in Tallawong. I feel like we're seeing the fruits of our labour, and it's very rewarding, and it hits in a different way to having stepped into a practice that was already a well-oiled machine. Interestingly, there's more trends in orthodontics than I imagined. Firstly, there is a trend towards digital orthodontics. We're using more and more digital tools to help us diagnose, as well as plan and customize our treatment for our patients. For example, with aligners, which are clear, almost look like retainers that are used to move your teeth instead of traditional brackets. You can really customize each aligner treatment plan to suit the patient's needs, and also we can combine it with remote digital monitoring as well, so patients don't always have to come in every 8 weeks in order to get an adjustment. If we have a busy adult who can't come in as frequently, or a uni student who doesn't have the time or flexibility to come regularly, then we can actually supervise them remotely as well. And nowadays we can also 3D print appliances as well as brackets, really customize the tip, angulation and torque for each tooth. So orthodontics has really evolved and come a long way in order to perfect treatment and the diagnosis for our patients. Another trend that I'm seeing is more and more patients are asking me to treat them without taking out any teeth, so with a non-extraction approach. And so there is definitely merit in trying to approach treatment plans with a non-extraction approach. However, we have to be cautious. Can't have a cookie cutter method, because, for example, if you have severe crowding and we try to fit everything in without taking out teeth, you can really push the teeth outside the envelope of your jawbone, and that can have silent detrimental effects over the long term, because you don't always see recession straight away, but it actually happens years down the track. So we have to respect the boundaries of the jawbone, as well as each individual's gum type, like a gingival biotype as we call it. So there's a lot of factors that go into planning for each individual patient. So while I understand that some patients come in with a demand for non-extraction orthodontics, sometimes I just have to explain to them that that's not always the best functional as well as aesthetic outcome. A lot of parents think that an orthodontic checkup is only necessary when kids have all their adult teeth, but that is a myth. Definitely it's better to get an orthodontic checkup as a young child, around 8 years of age, because there may be some early problems that are developing that could impact the child's growth and development. For example, if you have a crossbite, which is where your upper teeth are sitting inside the lower teeth and you're shifting laterally to one side, then you can actually promote asymmetric growth. And so that kind of problem needs to be addressed at a younger age, even before you have all your adult teeth. So I think that's one misconception in orthodontics. Another misconception is that you can wait till you're an adult to treat every orthodontic problem. While some people can wait until they're adults, there are certain cases where we need to catch them during a window of opportunity. For example, if we need to do growth modification in kids who have a bit of deficiency in their lower jaw and we need to help encourage their lower jaw to come forward, there is a window of opportunity around the pubertal growth spurt that we need to be able to catch at the right time. So it's very important for us to do an early assessment of what's necessary for kids. I think I learnt my work ethics from my parents, who were always hard workers. My dad and my mum. My dad was an engineer and my mum was a school music teacher. So I don't have anyone in the family who was a dentist or involved in the field of dentistry, but I did learn their work ethics from a young age. And so I approached orthodontics and my job with the same mindset. But the more consistent I became with treating my patients and developing a pattern for which I diagnose my patients, I started to really enjoy this space, and I've developed my own philosophy over time, and just coming to work, it's almost like a second home for me, being with my staff members who are so respectful, and we always try to foster an environment of respect. Sometimes I come to work and I can leave all my personal problems at home, and that just brings me back into this space of stability. So I don't think that I've had a passion for dentistry that sparked my interest in orthodontics. I think sometimes you can develop this passion for what you do by just showing up to work every day. And so for me, I think it's probably the latter. I like to play tennis. I get lessons every week and I try to play with my friends who are also into tennis. I'm still not great at it. I'm still learning how to serve properly, but it's been a passion of mine. Also, I love scuba diving. So next month I'll be going on a liveaboard trip where we'll be scuba diving next to minke whales. There's a migration of minke whales around the Cairns area, and that's something I've always wanted to do for a while. And I've got my advanced scuba diving certification now, so that'll be really, really fun.